Hello everybody. We will give you an educational lecture regarding the emerging corona pandemic, COVID-19. We will give you just a brief history about the coronavirus. All of you think that this is a very new virus, which it's not. It's only a new strain of a virus of a very large family of coronaviruses. The previous coronaviruses were the SARS virus that it was discovered in China and the MERS-CoV in Saudi Arabia. The COVID-19 is just a new strain of coronaviruses. The history of the discovery of this disease, it was discovered in a city called Wuhan, a cluster of 27 unknown cases of pneumonia in a seafood market. Then further investigation, further studies, they finally announced that this is a new corona virus, a new strain. It was previously transmitted from animal to human, but then it has been mutated and now it's been transmitted from human to human. This will give you a general idea about a global COVID-19 emerging. It was started in a city in Wuhan and then all over China, and then it has gone through all of the worldwide. The first UAE confirmed case was in January 27. Also, the most important information recently, the WHO in March 11 has announced that this is a pandemic. And all the countries worldwide should increase their precautions measures to control this pandemic disease. Up to March 17, the total cases, confirmed cases, were 182,413 cases. Total deaths were more than 7,000. The recovered were approximately 79,000 worldwide. In the UAE, our total cases of confirmed cases are only 98. Total deaths, thank God, it's 0. And our recovered patients were 26 cases. This is a very important slide. This will give you an idea how this virus is being transmitted from one person to another. It is not an airborne like everybody is thinking. This is only transmitted, all the studies are saying that this is transmitted by a contaminated droplet. What do I mean by contaminated droplet? It is when a person is coughing or sneezing. The virus are in the droplets, and the droplet will be traveling for a certain distance and then it will fall down on the surfaces. The distance that this droplet is traveling is approximately 1 meter. So that's why the mode of transmission is by 3 things: sneezing, coughing, or a contaminated droplet, and then you will be touching these droplets and then you will get the infection to you. That's why we are always saying keep your distance from anybody who is showing any respiratory symptoms, at least a meter length. Sign and symptom of this disease is as sign and symptoms of any upper respiratory tract infection. It is very general, and it is you cannot distinguish between a normal common cold or a COVID-19. The symptoms are sore throat, fever, headache, shortness of breath, coughing, and in severe cases, a pneumonia can develop. The incubation period of this disease will range between 1 day up to 14 days. 80% of the cases are recovered without receiving any special treatments, but 1 out of every 6 people who gets the COVID-19 can become seriously ill. And from those are mostly the elderly people, those who are 50 years and above, and those with any chronic disease like heart disease, respiratory system disease, or diabetes, and anybody who is having a low immunity for any reasons. Those are there are most groups that are vulnerable groups, and they have to take extra precautions and extra care in case they will get the disease. Now, is there any vaccine for this or any treatment? No. Up until now, there is no specific vaccine meant to protect you from COVID-19, and there is also no specific treatment. By treatment, we mean there is no antiviral is designed to protect you from this disease. The only treatment that are given to the patients are supportive treatment. For example, if you have high fever, you will be getting a medicine to decrease your temperature. If you have an infection, you will be given a medicine to fight the infection only. So the patient's recovery will depend on two main factors. It will depend on how your body is immune and what kind of medical care is provided to you. So how can you protect yourself from it? First of all, you should avoid getting close contact with anybody showing any respiratory symptoms. Secondly, you should always keep your hand clean, either by using soap and water or by sanitizer if you don't have soap and water, for a period of time not less than 20 seconds. Also, if you are having any symptoms, you should avoid traveling at that period of time. When you are coughing or sneezing, you should cover your nose and mouth in a tissue and dispose that tissue immediately. If you don't have a tissue at that time, you always use the bend of your elbow to cough or sneeze in it. And also, when you are dealing with animals, it's better for you to continuously keep your hand clean. How to protect yourself when greeting in a gathering? You should avoid nose-to-nose greeting. You should avoid hugging and kissing others. You should also avoid shaking direct hands for them, and just say hi from a further distance. And if anybody is having symptoms, he should avoid going to close contact with everybody or going into these gatherings. Also, always keep your hand clean with sanitizer or water and soap. So it is very important for you to keep your hand clean, because as we know, it is transmitted by contaminated droplet. And if you kept your hand clean, then you will decrease the chances of you getting the disease. There is a certain way of how to wash your hand. The next slide will give you we will show you a short video on how to wash your hand properly. So, if you want to travel to an area affected with COVID-19, what you should do? First of all, we are advising you to avoid traveling to these countries unless it is very necessary, and always you should refer to the official sites such as the Ministry of Foreign Affairs and International Cooperation. You should get your information from credible and official sources such as the Ministry of Health and Prevention channels, just to know what are their advice about these countries and what are the advice for traveling. And then if you have to travel for the necessity, then you should avoid getting contact with animals, whether they are live or dead. And also the products of the animal, you should make sure that it is cooked properly. Avoid getting contact with anybody showing signs of upper respiratory tract infection. Keeping your hand clean either by washing it with soap and water or by sanitizer, and then cover your cough and sneeze with tissue and dispose it immediately. So, what to do if you have symptoms and you have a history of a recent travel, or you had a history of a contact with an infected person? What you should do? First of all, you should stay at home and avoid being in contact with others. You should avoid traveling during this period of time. You should also cover your mouth and nose when you are coughing and sneezing. Keep your hand clean all the time, and then you should contact your nearest health center. Just tell them that I have symptoms and I have history of travel, or I had history of contact. and then you can visit the nearest health center, and then also inform them at the time that you reach there that I have the symptoms plus the history, and then they will take you to a specialized doctor. He will do the necessary test for you, and then the guidelines and the protocols will be continued from there. A frequent asked question, these questions we gathered from a lot of people were asking them, and we try to collect as much as we can the frequent asked question by them. First of all, there was a lot of talk about the face mask. Face masks are only recommended for sick people, or if you are taking care of a sick person, or if you are working in the medical field. So wearing mask is not recommended for healthy people. What about if you use a gargling mouthwash? Will that protect you from COVID-19? No, there is no evidence of that. Is it safe to receive a package from area with COVID-19 has been reported? Yes. The chances of you getting an infection from these packages are very low. It's very unlikely, and there is no any study saying that you might get that one. So it is safe for you to receive any packages. Can I catch COVID-19 from my pet? No, there is no evidence that at the present time that your animal or your pet can be a source of infection for COVID-19. What about eating garlic and many herbal medicines and these things? For sure they are healthy food, but that does not mean that it will protect you from getting the disease. It may only boost your immunity, but not necessarily will protect you from getting the disease. Okay, so why we keep repeating and telling you that you should avoid touching your eyes, nose, and mouth? Because the disease is transmitted by contaminated droplets. So that means that if you touch a contaminated surface and then you touch the mouth or your nose or your eyes, then you will get these droplets into your system and your body. That's why we keep on telling you stop touching your face and keep your hand clean all the time. Okay, so a lot of people think that this virus is an airborne virus. No, up until now, all the studies are saying that it is transmitted by contaminated droplets only. Okay, so what about the virus? How long it can survive on a surface? It depends on many factors actually for a virus to survive on a surface. It should depend on the temperature that it is in it, the humidity of the area that he is in it. In general, a virus needs a living body for it to survive. So it will not survive for a very long period of time on a dead surface. Can antibiotic be effective in the treatment of COVID-19? No, antibiotics are designed to fight bacteria only. What about vaccine against pneumonia or vaccine against influenza? No, these are designed just to protect you from pneumonia or from influenza if it's a vaccine for influenza. Up until now, there is no vaccine designed to protect you from COVID-19. So, only old people are at risk? No, this virus does not discriminate. It does not differentiate between your age or your sex or your nationality. Everybody is at risk of getting the disease. Why we always keep mentioning the elderly or the chronic disease patients or the pregnant ladies or those with low immunity? Because they are the vulnerable groups that are at risk. In case they got the disease, they will have the higher chances of having the complication of the disease. That's why we keep on telling them, and the recent guidelines are, the Ministry of Health and Prevention are recommending these groups to stay in their home, avoid going to public places, avoid going to gatherings, and avoid being in contact with a lot of people. That's why, just for them to be safe. That does not mean that they are the only people who will get the disease. Okay, so is there anything I should not do? The following measures are not effective against COVID-19 and it can harm you. Smoking can harm you. Masks, as we said, masks are not recommended for healthy people. They are only recommended for the medical field and those who are sick or taking care of a sick person. What about you taking your medication without consulting your doctor? This is also not a safe way to do that one. Antibiotics should be prescribed by a physician, and he should assess your case and then suggest what to do for you. In general, if you have any fever, cough, or difficulty in breathing, you should seek the medical care, and to reduce the risk of developing a more severe infection. Always we are recommend you to get your information from the reliable sources. The sources are the Ministry of Health and Prevention, Dubai Health Authority, Istijaba Service at Department of Health at Abu Dhabi. These are the official sites that you can get your information from it. Also, you can always call them 24/7 in case you have any questions, in case you are worried or you want to clarify some information. They are there. The call centers are working 24/7 just to answer your questions. We are here to teach you some precautions steps for you to protect yourself from any infectious disease. In general, for COVID-19, we recommend for you to keep a safe distance between you and the one you are dealing with for at least a meter distance. Secondly, you have to keep on continuing to keep your hand clean with soap and water, or to use the alcohol-based sanitizer. Also, you can use for the frontline employee, we need to teach you about how to wear the mask properly. First of all, the mask is coming in two different colors. There is a colored side and there is the white side. The best way to wear it is for the colored side to be from the outside. Secondly, there is one side without a metal, the other side there is a metal for it. This metal should be on the on your upper, it should be up, and because it should touch your nose and you fix it on your nose. So now he will show you how to wear the mask properly. So first of all, you put it, and then you will fix the metal on, you fix it on your nose bridge, and then you will tie it. And make sure that the tie is secure enough. Okay, the second one. Okay, so you have to check that this is fixed on your nose bridge. Secondly, this should go beneath your chin, and you should push it to be beneath your chin. Okay, and then when you remove the mask, you should not touch this area at all, and you can only open the tie and dispose it immediately. This mask is not a frequent use mask. You can use it only for one time, and if it gets wet for any reason, you should dispose it immediately and wear another one. So as you saw, he just opened it and disposed it immediately. Surgical gloves are meant to increase your protection against the droplet, but that does not mean that you should keep on touching your clothes and your face frequently. So you should wear the gloves, and it should be properly sized to your hand so you can work with it comfortably. The only thing that you should take care of it is while you are removing the gloves. To remove the gloves, you have to make sure that you are not touching the inner side of the gloves. You should touch it from the outer side of the gloves and then remove the first one. And before you remove it, you have to remove the second one also. That's because the gloves are already contaminated, and we don't want it to be infecting your hands. So this is the proper way of disposing the gloves. After you removing the gloves, you should dispose it in a safe bin, and then sanitize your hand. At the end, I would thank you, all of you, for listening. And I'm just one last advice. No need to be panicked, no need to be worried a lot, because if you were worried and panicking, you will not think clearly, and then you will forget of what is the right way to protect yourself, and you will miss the precautions and the precautions that we mentioned and how to protect yourself. Being worried will not help you in the protection, but following the precautions and the necessary guidelines, this will help you and protect you from getting the disease.